I was listening to NPR at the end of the year, and every year they wrap up the year with their year-end quotes, some of their favorite quotes from last year. And one of the ones, their favorite quote last year was someone from a healthcare town hall meeting stood up and said, "You keep your government hands off my Medicare." And I think that that's a real question right now. A lot of people are worried about healthcare reform, and now that's going to change everything. But how is healthcare reform going to change Medicare benefits?
Okay, there's a number of ways. In terms of the way that the Medicare beneficiaries will feel it, the first thing that they will notice, which occurs this year, 2010, will be in terms of the infamous donut hole. Now, the donut hole is that portion of prescription drug costs that are not covered under the Medicare prescription drug program. Now, that's the so-called Part D program. And basically what it is when an individual on Medicare has been getting prescription drugs through the Medicare Part D program, and their prescription drugs have reached a level of $2,830 in that particular calendar year, many of the prescription drug plans, these Part D Medicare plans, stop coverage. No more coverage until you've paid out an additional almost $4,000 out of your own pocket. And seniors are very concerned about that. I will point out this doesn't apply to everyone. There are a number of individuals, lower income individuals, who qualify for something called the low income subsidy, or also known as extra help. Mm-hmm. Those individuals don't have the donut hole, so they're okay. But for the individuals who are at risk of having to pay out of pocket once they reach that $2,800 limit, the healthcare reform will provide them with help. The help will start this year with a rebate. Once they hit that amount and they start shelling out of their pocket, 100% out of their pocket, they will be entitled to a rebate of $250 this year. Then what will happen is the amount that they'll be liable to pay will reduce over the next 10 years, so that ultimately for this donut hole amount, they will only be responsible at the end of 10 years for 25% of the prescription drug costs, while right now they're responsible for 100%. Mm-hmm. In addition, next year, 2011, when they hit that donut hole amount, that $2,800 amount, they will be entitled to a reduction in the cost, a rebate, if you will, in the cost of generic drugs, 50% of the cost of the generic drugs. So they'll be paying half of what they had been paying for generic drugs. The same will happen for the name brand drugs. Again, they will only have to pay half the cost when they hit that donut hole, starting in 2013. So those are important. Another important change for beneficiaries is in terms of coverage for primary and preventive care. The new law will now cover preventive care, subject to the definitions which will come out later, at full coverage without copays and deductibles. And persons on Medicare will be entitled to one comprehensive preventive care evaluation. And this is sort of like a super checkup. Okay. That'll be free, where the idea is to work with your primary care physician to look at all the health risks and come up with a plan how you should address the health risks, diet, exercise, medications, the whole thing, and that for one of those visits would be totally free, no copays or deductibles. The last thing I want to mention, although there's a number of technical changes, there will be changes on how the Medicare Advantage plans are paid. Now, the Advantage plans are mostly these Medicare HMOs, where you trade in your regular red, white, and blue Medicare card, and instead you get an HMO card, what it's paid for through Medicare. And while the payment changes are very technical, we have to wait and see how that will impact the number of health insurance companies that offer these Medicare Advantage plans. We may see some changes. The amount that they're getting paid in some cases will be reduced, so there may be some plans that stop taking Medicare. On the other hand, there will be extra incentives for plans that meet certain quality requirements, certain quality benchmarks, and they'll actually get more money. So we may be seeing some changes in the market of HMO and Medicare Advantage plans. So those are the primary changes we're going to see in Medicare. There's not going to be any panel that decides whether you get health care at the end of your life or tells you when you live or die or anything like that. These are not the kind of dramatic changes that people are very afraid of. By and large, they will be positive changes.
And can people find out more about those changes at Medicare site or at the Pennsylvania Health Law Project site?
Yes. Actually, the federal government, which operates the Medicare program, in fact, it is a government program, is Medicare.gov. So www.medicare.gov is a very good source of information around that. And there's also a federal website, healthreform.gov, where they can get more information as well.